one. Time now 7:46. President Obama held a health care summit yesterday and indicated he had an open mind to all ideas for making a plan work for all Americans. Jerry Flanagan joins us from Los Angeles. He's with Consumer Watchdog and is the group's lead advocate for health care reform. Jerry, good morning.
Good morning, Ross. How are you?
I'm doing very well. Let me start with the reaction a lot of people have with our economy in such bad shape. This is no time to be doing health care. Your reaction?
I think just the opposite. Obviously, health care figures in as a major expenditure for most families. And the idea is that if we don't reform health care now, then the economy can't recover. And because the economy is getting worse, the availability of health care will keep going away for many American families unless we deal with some of the cost issues and access issues immediately. So I think what the president has done, and I think correctly, is articulate health care reform is a big piece of the economic recovery for the country.
Okay, so we better understand this, Jerry. What kind of plan would the president like to see?
Well, he promised when running for the office that he would provide Americans an option to a public program. The idea would be that Americans could either keep their job-based insurance that they have or their individual coverage if they have it, or they could choose to enroll in a public health care program. He's described it as something like Medicare or to join Medicare directly. Now, the reason you'd want to do that and join a public program like Medicare is that Medicare's overhead, the amount of money it spends on running itself on administration, is about 2 to 3%. Compared to the private market, we spend about 30 to 50% of our health care dollar when we spend to a private company, a private insurance company, on overhead. So the point is that private companies are much more inefficient with our dollar. So if we were allowed to join a public program like Medicare, we would get much health care for our dollar. Recent reports have shown that the same coverage you're currently getting from a private employer, if you were to choose to buy it through Medicare or another public program, would cost about only 75% of what you're currently spending in the private insurance market.
So if we had a government program, and I know this is, they're just, these aren't details because they haven't put any kind of plan together, but what they're kind of searching for, would you have flexibility in your plans? Would you have a choice of your doctor? Can you go to the same doctor you've always gone to?
Absolutely, and the key thing to remember here is that this would be an option. What we're not talking about here is replacing the existing system with a brand new government system. What it's essentially saying is that we're going to keep the same system and we're going to add on this other government option as well. So when your employer offers you Blue Cross, Kaiser, Blue Shield, you also have the option of the public plan. And you might want to join that because you're going to get more health care and it's going to be less likely that your employer is going to have to cut it because of cost. The government plan would provide the same access to doctors and hospitals that you currently have. So it would not be any change to your existing health coverage. It just means you would be paying less for the same amount of health care.
So what would make employers have medical insurance then? Why wouldn't they just say, well, let's let the government run it?
Well, you'd still have to choose as an individual to join a plan, and the public option would not, you'd still have to pay for it. So it would still be on you to help pay for that plan. The difference is that instead of paying or your employer paying for a more expensive private plan, the employer or you would spend less on the public plan. That's good for the employer because that means the employer can save a little money in these tough economic times. It's also good for the individual. So
you're still paying for this and all. The president says he wants a plan on his desk by Labor Day. Is he going to have it?
Well, you know, it's a really aggressive challenge he's put to Congress, although we saw this week that both Max Baucus, who's the finance chair, and also Senator Kennedy, both we're going to take that challenge and we're going to focus on getting a health care plan out of the Senate by summer. If they do that, then conceivably, yes, we'll have a plan on the president's desk, by August.
All right, Jerry, good talking with you this morning. Enjoy your weekend.
Good talking to you.
Jerry Flanagan, live in Los Angeles, 7:51.